Hello and welcome to another Digital Health Talk Hanover. Our topic today, health services in native language, digital problem solvers for challenges in medicine. Our Digital Health Talk series is a cross-sectional perspective on the healthcare system here in Hanover and the region, and would like to introduce the players from the network, such as researchers, politicians, and businesses with each other. So we offer an opportunity to get in contact. My name is Lesley Plön, and I am project director at hannoverimpuls for business development in life sciences and medtech. Imagine you are in a foreign country, need medical device, but you do not understand the language. This is a difficulty for approximately every third German with a migration background. So can health services in native language be a problem solver for this issue? I would like to welcome my first guest, Reza Esfahanian. He is CTO and co-founder from a Hanover-based startup named Kipoli. His business has developed an app which allows patients to contact medical personnel when in a foreign country from all over the world in their native language. He has gained a lot of experience in the Middle East and has, I think it's 150,000 users with his app already, and his next step is now to launch in Germany. My second guest is my dear colleague Cornelia Körber. She's also project director at hannoverimpuls for business development in life science and medtech, and is working on the big project and initiative Digital Health City Hanover. She knows what it means for innovative startups in digital health to go into market entry. A warm welcome to both of you and to our audience watching behind the screens today.
Thank you, Lesley.
Thank you for having me, Lizzie.
Dear Reza, can you go into more detail about your app which you have developed and what problems you're trying to solve with this?
Yeah, let me first begin with a little back story of our company and how we came to developing an app for patients with migration background. So the healthcare industry is one of the largest in the world, and countries on average spend about 15% of their GDP in maintaining the public healthcare. And so there are many challenges. On one hand is that the equality of access to standard healthcare has been difficult for the last decades, and also patients cannot have their needs for getting medical attention or medical care that is necessary. So Kipoli started by putting patients at the center of focus, and by knowing that no one company can challenge, can solve or have a solution for the big challenges on a global scale. But we thought that most or the majority of Earth population lives in developing countries, and any solution that wants to scale on global level has to have a connection with the developing countries, and even small solutions make a bigger impact in those countries. So just to put it in a sentence, this was a bottom-up approach that we took. So we wanted to build bridges between countries and empower specialists in their home country to have access to the new technologies and new researches that are being conducted in the industrial countries. And also to build the bridges between countries without the main target group are the people who have migrated from these countries to one another, meaning from developing countries to Europeans or vice versa. And so we started to focusing on that specific problem of offering assisted healthcare to those patients. So that would be the topic of our discussion today. So it came actually from a personal experience that I had in Germany, and why that I had a difficulty at the beginning of my residency in Germany, and I couldn't explain myself to the doctor, and the doctor who was not able also to speak English. So having that in mind, we launched our platform in the Middle East, and we established ourselves to have a platform for patients who do not have access actually to the standard healthcare in their home countries. And now we want to bring the specialists in Europe to work with them in helping helping people with migration background in European countries, especially Germany.
It sounds surprising. You funded in Hanover, but you launched in the Middle East. How come?
Yes, so going back, because startup or a single company cannot face big challenges of healthcare. So we wanted to have a bigger impact with or more significant impact by implementing our solutions. So we were looking for potential regions where such as Latin America or South America and Middle East, and we could establish connections in the Middle East, and we were able to gain traction from the specialists as well in the region. So it was kind of facing the needs at the right place at the right moment.
Cornelia, could you please briefly outline for our audience who maybe don't know what Digital Health City is yet, what it means for us and what the goals are that Digital Health City would like to achieve?
Sure. So Digital Health City Hanover is an initiative by hannoverimpuls, but definitely not only run by us. It includes a range of collaboration partners, because we have three big goals that we want to reach. We want to be the innovation driver. We also want to have a very active ecosystem, and also this all together is supposed to have international reach and awareness. So by putting those three goals together, it just means that we want to help this industry all around digital health in Hanover to really exceed what they already do, and to collaborate together and to find new partners.
Okay, so concretely, what does that mean for Risa and his startup?
Yes. So for Risa now and for his startup, the possibility is that he can reach out to a wide range of people that are also involved in digital health and with founding a startup in Hanover. As such, we have different formats. One is the one that we do today. It's the Digital Health Talk, so we can listen in. But we also have now newly established meetups. There was one this week that was quite fun, where over 70 people attended from complete different industry sectors, but all having to do with digital health, getting the possibility to connect and maybe even to find knowledge or a partner that helps you further. Also, of course, we have the website digitalhealthcityhannover.com, where you can list as part of an ecosystem. And being an ecosystem partner there gives you visibility. So as a company, you can show that you're part of the network. So if someone else is looking for what's actually happening around in Hanover, you can be seen. And on top of it, of course, there's also consultancy services and support by hannoverimpuls, but also by the other cooperation partners that can then support with advice, but also with the whole funding process as such.
So networking, building up connections, receiving advice and communication help. Risa, where does your shoe pinch the most for market access?
Yes, so the German health care system in general, or the European healthcare system, has been established for the past decades, and it's really difficult and rigid to make new changes or bring new solutions that are revolutionary and are gonna require new approaches and new processes. So Hannover Impuls and such institutions can help us bring policymakers and regulatory authorities to, first of all, understanding these type of new innovation and finding new methods for integrating these type of solutions to the German healthcare system. So first and most significant role that Hannover Impuls could play for startups like us is to help us communicate our needs and our missions and visions with the policymakers. And the second would be, as Cornelia described, is that making our collaboration with the large corporations possible, because they are too large and they have their own bureaucratic processes, and overcoming these processes would or actually going through these processes as soon as possible, because startups, they are going to become scale up very soon. If they not, they are going to go out of the market at the early stages. So we want to become a scale up in the next 2 years, and establishing this communication and collaborations with enterprises within Germany is very, very required for us.
Can Digital Health City be of help to this process or to these questions, Cornelia?
Well, absolutely. I mean, specifically the network part and perspective is something that we can do, first of all, of course, within Hanover, but also internationally. We do this talk in English today because we have a range of partners from, I can say, all over the world, but we also have a clear focus on the Nordics, which are very far in digital health. So there is good possibility to find someone that boosts the development of a startup becoming a scale-up. Further, the question that Risa said about regulatory affairs, what we can do is to help with a range of experts who can consult and give good advice, also from an early stage on what you need to consider. What we can't do, unfortunately, is we cannot change policy making. That's not in our hands. Digital Health City Hanover is, of course, also dependent on what the state is giving as a setup.
Yes, yes. As our chancellor lately said, in a different context, though, we need a WUMS, or in another different context, again, we need a Doppel-WUMS. Cornelia or Risa, do we need a digital WUMS?
Okay, well, you want to go first?
No, you go first, Cornelia.
Well, I think we definitely need a big WUMS still, that we know that even though the demand is very high, and I think we also saw this at the meetup that we had last Wednesday, so many different people coming together, really eager to drive innovation and to make a difference for the healthcare system, and specifically in the area of digital health. However, it is still very difficult and complicated with all the regulations around, and it's not easy. So I think, yes, we still are very much in need of a WUMS. Risa, what's your take?
Yes, absolutely. I guess every stakeholder has in his own interest. We have different stakeholders, from single clinicians who have practice, and we have large hospitals, and on the other side there are insurance companies and pharma tech and med tech. So all these players are seeking their own interest, which is right, which is the foundation of any type of business. But I guess policymakers and also the public sector they should establish a common ground for all these companies to understand each other, because if we want to rely on the previous regulations and policies, we are not going to go further than this, what has been achieved by now, because we are standing at the edge of either we go and we break the ceiling glass, or we are gonna stay and go through a rabbit hole and do not achieve further innovative technologies at scale. So yes, I agree with Cornelia and the Chancellor.
So we will see what will come, or what the future will have in hands for us. Cornelia already said Digital Health City organizes networking events such as Digital Health City Meetup. And you, Risa, you are looking for collaboration for your startup. Can you maybe tell me practically, how difficult is that for you?
To find a collaboration with other companies?
Yes, or for example, you said beginning patient data, how do you get to information?
Yes, so it's pretty difficult to go, because the healthcare system uses the software and the systems that have been developed like for 30-25 years ago. So they have data silos, and they have, and on the top there is a like 1 kilometer thick regulatory necessities and essentials that no startup or any medium-sized company can fulfill. And so actually, as I said, the finding new collaboration requires a common ground with the other players, which are pharma tech, insurance companies, and med tech companies. And I could fortunately, for example, have a discussion 2 days ago at the event with one of the largest medtech company in the world. Thanks to Hannover Impuls and Cornelia for having having these type of events in Hanover. So as I said, it's it's sometimes on one hand it's very simple, bringing startups with big enterprises together, and maybe they can understand each other at first discussion or at first sight, but having actually going through integration and going through making those changes, that takes a lot more effort from each party at this point.
Cornelia, you have, of course, a lot of contact to startups or businesses with an interest in growing. Is Risa's case an individual case?
Well, I don't think so from the essence, like the basic need, finding right partners, finding expertise, getting help is something that any startup, any company needs, whether they're international or whether they're local. So we see this with companies that are, for example, coming from our own incubator, the female health incubator, now starting to become the future health incubator next year. We see this with companies, startups, or usually it's a scale-up phase entering the German market from the Nordics. It is, and as such, quite good that the same need and demand is there. However, of course, each company particularly is very different and usually needs a different kind of expertise or a different person, because our healthcare system is so complex that depending but what we know, whether it's outpatient or inpatient care, different reimbursement models, depending on the regulatory affair. Is it pharma, is it medtech, or is it digital health only? So that varies a lot. And there I would also like to add to what Risa said just before, that it's not just Hannover Impuls, and I thank you for being so appreciative of what we've been doing, but Digital Health City Hannover exactly aims to be bigger. It aims to include so many cooperation partners that we can also offer this range of expertise and network that is needed to address the complex demand that is there from each and every individual company.
Yeah, Risa, can you tell me what is your long-term vision? If you imagine yourself and your company maybe in 5 to 10 years from now?
Yes, we have 5 category of products, and so we have discussed today one of them, which is a mobile app for patients to have to receive health services via their device. And having said that, other categories which are much more complex than the mobile app, they include clinical decision support systems for complex diseases, and these type of platforms have much higher requirements which we need to fulfill before we can launch it, for example, in Europe. So our goal and our mission is to establishing an international network of, or better said, a platform which provides the possibility for other players to conduct R&D, research and development, as well as deploying their services which they have developed on their own, and bringing actually going beyond borders and barriers. This is our main goal, and that's how I see the company going forward. And for achieving this goal, we are not afraid of new challenges that we are on our way. And I'm pretty sure and very optimistic because Digital City Hannover has been launched very recent, and that shows there is a light at the end of the tunnel.
Cornelia, what is your long-term vision for Digital Health City Hannover?
The long-term vision is that we have a range of projects established here that are really driving innovative technologies and products forward, that is also giving a range of people interesting workspaces here, and that we are very collaborative and cooperative within each other, that we know of each other, but also abroad, and that they're very close connections, and mostly that within the whole system that we said before, we can't influence all of it, but that for a better future for all of us patients will be met in a digitalized healthcare system.
Well, many thanks to both of you for being here today and deep diving into the topic of health services. Thank you to both of you. So our learnings for today: health services in native language can be problem solvers for tomorrow, especially in our immigration country here in Germany and basically all around the world. High barriers for market entry, however, still exist and will probably still exist in the future. And Digital Health City Hanover can be a possibility to help bring people into contact with each other and let the information flow more easily. Dear audience, if you are looking for contact, do not hesitate to write an email to any of us. We will be happy to answer or even give you a ring back. So this was our last talk for this year. And we will be coming back next year on the 13th of January. There we go, had a couple of technical problems. My colleague, Melissa Jung, will be doing our next digital health talk on the 13th of January on the topic data security, again on a Friday in a 25-minute cycle. If you would like to have a look on our talks, which we have done in the past, feel free to visit our website, digitalhealthcity.de. And we have uploaded all our talks. So if anything catches your eye, you can rewatch anytime, anywhere. Last announcement, our Digital Health City now also has a LinkedIn account. So feel free to follow. You will always be updated with our latest news. So that's all from us for today. I hope you enjoyed it. Thank you to our speakers and thank you to the audience for watching. I wish you all a nice weekend. Bye.